So why is that all important? It sounds irrelevant, but it's actually very important. So this is what we're seeing on the left is the excess deaths. So that's the deaths above the 5-year average on a weekly basis, and they've been going up very, very dramatically. And we have this category called COVID-related deaths. And as I explained, that's deaths from COVID and deaths where coronavirus has been present and COVID has been in section 2 of the death certificate where it's not the cause of death, you know. So I've tried to get from dying with the coronavirus to dying of the coronavirus. And I'm not going to go into the maths of that, but there's a mortality table for the coronavirus, and I've applied that to the death certificates where coronavirus has been mentioned, and I've ended up with about 6% of those death certificates actually being due to coronavirus. And in a way, that makes sense because if you go back to that number of 2.6 for the population at large of the people with symptoms, in this, it just works out mathematically that in this group, which is mainly older people, that works at about 6%. So why it's important is because, as far as I'm concerned, if this is correct, then you're seeing very, very few deaths from the coronavirus, COVID-19, and virtually all the deaths are coming from reasons other than COVID-19. And that's important because that will give you conclusions which are totally different to the actions that we're taking at the moment. Just to sort of add, I just picked one number from the US. Here you can see in the New York, this is New York City or state, I can't remember, but about a third of deaths that are registered as COVID are classified as probable. So they also are adding in to their statistics things. I'm not sure how they do this, but there's obviously a group of deaths which are sort of borderline, but quite large as a percentage. They're also being treated as COVID. So why is all that important? So if you reclassify deaths where COVID is mentioned into deaths from COVID, you end up with a very large number of deaths having nothing to do with COVID. And that brings us to the reorganization of the National Health Service, and that has been redesigned to deal with COVID. And again, I think you start putting in a chain of events now where you start thinking about the 510,000 and the policy decisions and actions that triggered. It was inevitable you were going to reconfigure the National Health Service because you have a very scary number out there, and that's basically what's happened. And I looked at A&E admissions here, and they were 128,000 people lower in March 2020 versus prior year. I mean, it's a staggering number basically, and I think it's now becoming clearer and clearer. Quite a few of the NHS doctors are coming out saying, I don't have patients. People are still getting ill. They're not being treated, and this is, I think, it's not just a conscious decision on the NHS part. There's also the fear that's been drummed into us to sort of hide, and people, I'm guessing, are not going for treatment when they should be getting treated. And I think that's the reason why you have this big spike in non-COVID related deaths. And to be, as far as I can see, that's a direct policy. That's a result of policy. It's nothing else basically, and it's a big number. And as you could see in that other chart, it was much, much bigger than real, genuine deaths from COVID. I mean, many-fold bigger. So, last thing about statistics then is another mystery which I can't fully solve, but I can just say you have to work around it. This is the famous number of why the UK has 12% deaths to cases versus 2.5 for other countries, and again for the famous Diamond Princess case, which I keep using throughout this. I think it's the only way to navigate these numbers. And the simple answer is that the Department of Health and Social Care have an even more confusing metric that's even less useful because it's based on deaths in one part of the chain, which is in the hospital chain, and it's based on people tested for COVID. And I'm not even 100% sure. The wording just says tested. I don't know if it's even tested positive or negative. Assume it's positive, but it doesn't. It's a number that is meaningless. So when you see lots of people drawing charts and comparing this and that, they're comparing apples with oranges if you're comparing across countries. And even internally here, it really doesn't mean anything, unfortunately, that number. And the only way I can reconcile this is just to say, look, if you divide the deaths by five, you end up at the right level. And I think that's kind of the overstatement of COVID deaths if on this chart. Then if you divide by five, you're back where theoretically you should be. So, whoops, sorry about that. Let's see. Okay, so this then is looking at the COVID death statistics from the Office of National Statistics, which is the red line, which is sort of it's not even growing exponentially, it's growing. I'm not sure what the formula is, but it's a staggering amount, a staggering number. The blue line is the sort of imperial related doubles every 5 days line, exponential growth. And the green one is the one that I think actually are the COVID, genuine COVID deaths, is the green line, about 6.6% of the red line. And I think, as well as showing the ONS figures are very, very high, it also showing what you're seeing quite a lot now is the Imperial College exponential growth model for cases, deaths, whatever, is getting further and further away from what we're seeing in reality, basically all around the world. Those actual number of cases and deaths are not going up exponentially in the way predicted. So the last thing I would like to say about this is why is all this important? Because at the beginning of this, particularly this document, the purpose of the document was to find a way to organize ourselves through lockdown, etc., that did not risk having the health system overwhelmed with people. Now, I have some numbers about how many cases we actually have. I think you can generally guess that they're not that big. And then the capacity that you can compare against will be related to the seasonal flu capacity that we have in the system anyway. So every January, well, more or less every January, there's quite a big, or December, January, there's a big spike in deaths through influenza, which is the seasonal flu. And I found one here in January 2018. You had just over 3,000 deaths in that week, and that's 439 a day. Now, we've been able to handle that as a country without reorganizing ourselves, and that's a surge capacity. So if what you're seeing from COVID is within that number, because the seasonal flu is gone now, okay, there can be an argument about next season. But if the COVID deaths are within that number, there's really more or less plus or minus. I'm not an expert in the National Health Service, but from a maths point of view, there doesn't seem to be any need to reorganize the system to handle something that you've already handled in the past. And this is why I question what's the benefit been of reorganizing the system. There hasn't been the flooding that was predicted, and based on, again, my Diamond Princess numbers and some other numbers, it's not going to happen. And this is an open question because we have virtually no visibility into this model. Although I've spent 2 weeks looking at it, the assumptions are very opaque, they're very buried deep in the text, difficult to find, the code hasn't been released, and etc., basically. So personally, I think it's high time we actually understood what it is we're assuming and why we're assuming it. And in what I've seen so far, there's some very good guidance in the UK about how you model for pandemics, which kind of defines very many numbers to come up with a reasonable worst case scenario, which is it's not a possible scenario because they recognize there's no point in planning for something that's so remotely possible. Then you basically you reorganize your resources in a way that's not efficient. But so they've defined a reasonable worst case scenario. We are not working to a reasonable worst case scenario. If I've understood that, and if I've understood what's in this model, we are a long way beyond a reasonable worst case scenario. And I'll go through exactly where we are beyond the reasonable worst case scenario and what it means.